Welcome to the School of Unicorns. Today, I have with me a very special guest. For all of you, it's the first podcast in English, the first record podcast not presential, and it's really a pleasure for me to interview Dr. Victoria Sampson. And who is Dr. Victoria Sampson? He's one of the most brilliant dentists of England and of the world, of course. And she's known for her work developing on salivary diagnostics, microbiome testing, and incorporating artificial intelligence in everyday care. Her work has been acknowledged worldwide, resulting in her becoming of a scientific advisor, board member, and clinical lead of multiple dental companies globally. She just completed a postgraduate diploma in periodontologist. Victoria has been the forefront of change in dentistry by undertaking research projects in multiple fields of dentistry and taking a special interest in the relationship between the mouth and the body. She has published numerous papers in both UK and internationally, with her most recent publication in the British Dental Journal being the most cited and viewed article ever published. Most recently, Victoria has shortlisted as one of the most promising young dentists in Europe for the Forbes under 30, for 30 and under 30 in Science and Healthcare 2002 for her efforts and devotion to healthcare. She is the first dentist to ever shortlist for Forbes. Wow. In both 2021 and 2022, Victoria was also recognized for her achievements as one of the finalists for the award for the best young dentist in England by Private Dentistry Awards, as well as winning the Best Young Dentist Award by the British Endodontic Society in 2019. She has also won national prizes from the British Society of Dental Maxillofacial Radiologists and the Association of British Academic Oral and Maxillofacial Surgeons for her research. Victoria currently splits her time between two private dental practices based in Harley Street and St. James Park, as well as heading two clinical trials. And much more, for sure, Victoria.
Thank you for the introduction.
Thank you for accepting my invitation. I really had the pleasure to be with you like 2 months ago in London. I did you a short visit, and I was even more impressed with all of these. I learned a lot with you, but I have so many questions to ask you, and I think everyone should know a bit what you are doing right now. So that's why this invitation.
Thank you very much. I'm very touched to be the first international speaker. So it's a huge honor.
So let's start from the beginning. Tell me a bit your background before starting to know who is Dr. Victoria Sampson. Who is the person behind the doctor?
That's a strong start. So I graduated a couple of years ago, and to be honest with you, I wasn't that passionate about dentistry. I nearly dropped out when I was in my 4th year of dental school. I just really didn't like kind of the clinical side of dentistry. It was just a lot of drill and fill, and I didn't like it, and I wasn't passionate. And then I was lucky enough to go to Karolinska Institute in Stockholm. So I was chosen to go there for a 6-month Erasmus. And there I started learning a lot about the research between the general health and oral health. And they were doing tons of work on, diabetes and gum disease. And they were the first ones to really connect those. And that's where I was like, oh my God, dentistry is not just about fillings and veneers. There's so much more, and actually oral health is a really important piece of the puzzle for general health. So I graduated, I started working, and then COVID happened, and I'm quite a kind of high intensity person in the sense that I've never really taken a break. And all of a sudden COVID happens, and there's 4 months where I'm doing absolutely nothing, and I was going crazy. So I started to do research on the side, and I researched COVID and the connection with oral health. And that's where all of my research and all of my kind of passion and interests really started.
But how did you make that research? You went to to a lab that you normally use? It's easy to do investigation research in England?
No, not at all. So the first research I did, which was the connection between COVID and oral health, I literally was on a run, and I was really annoyed because I wasn't working, and I was like, what is this? I want to start working, and everyone was saying, oh, you shouldn't go to the dentist, and dentistry is really dangerous, and, wait at least a couple of years until you can go back to the dentist. And I was sitting there being like, actually, I think, keeping your mouth clean and healthy is really important to reduce your risk of diseases, of infections. And so that's where I started to do research. And I was just researching all of the papers and stuff that was coming out. And because it was COVID, everything was open access. So you had access to every paper that was being published around the world. And so I literally sat there and just read every single paper and started to collect them. And I wrote a paper which had basically everything all combined together. And that's the paper that was published kind of recently-ish. That was cited. And then after that, after that, I basically approached a university. So I went to UCL Eastman, and they decided to take the work that I'd done and actually make it a clinical trial. And then, so we went from there. And since then, I've kind of got to know a lot of universities and the research departments. And I'm trying to make researching stuff in general practice a much more easy thing to do, because right now it's very difficult, and all the research that's done is in hospitals by students as opposed to dentists in general practice.
It's the clinical evidence base now that we are looking for, and it seems that it's much more reliable and solid in the end, no? Because we are dentists, and it's the real clinic.
Exactly. We're the ones who are actually on the field working. We know what kind of research we need. And sometimes what annoys me is that the research that's being published for, someone's PhD, it's great, but it has absolutely no clinical application. And actually the dentist does not kind of improve the way they're working. And so that's why I'm really trying to push more dentists to, I know it's not the most money-making thing in the world. I know it's time-consuming, but it's something that will progress our profession and make us better dentists.
Yeah, and to add value to other people's clinics, no?
Exactly.
That's the more important.
Yeah.
So now I would love you to explain to me what is really this of the salivary diagnostics, and what you can find in our patient's saliva. What is the benefit that can come from there, and how can we use this in the diseases like oral and the other diseases?
So my dream is that you go to the doctor and you get a blood test, and you go to the dentist and you get a saliva test. And I think that hopefully we're starting to go down that route. Because saliva is actually, firstly, it's super easy to take. Just get someone to spit in a cup. It's not painful. It's easy. And second of all, we're finding that you can actually see a lot of enzymes, a lot of biomarkers, bacteria. People are now saying you could even check for cancer markers, for, vitamin testing, etc. through the saliva. And I wouldn't go that far yet, but what we can do from the dental perspective was we can definitely look at what bacteria is present, and look at enzymes as well, which are relevant for example, collagen breakdown. So there's one enzyme called AMMP8. It's in the mouth, it's in your saliva. And if you have lots of collagen breakdown, not only in your gums, so gum disease, but also in the rest of your body, then that biomarker is really elevated in the saliva. And same with bacteria. So I do a lot of saliva testing on my patients, and we look at all the bacteria in their mouth. And with that, we can basically see not only what kind of gum disease they have, how kind of aggressive it is and what the cause of that gum disease is. But also we have an insight into their gut microbiome because it's all connected. So I can tell if a patient has a kind of imbalanced gut microbiome, and also start to look at other diseases as well through that as well.
So nice. And tell me one thing about your patients. These are really special patients that look for you, that look for this kind of treatments, or because a normal clinic, a normal dental clinic doesn't have patients for this every day. Now you're gonna say, I'm gonna take a bit of saliva, and of course the patients, they trust you for sure. I would trust if I was a patient, but it's like it's bringing you so much people for everywhere, no?
Yeah. I mean, I agree. It's definitely not for every dentist. And I think that I'm very lucky to be in the position that I'm in where my patients trust me and they're happy to spit in a cup and for me to check their saliva. But I think it's actually been quite patient driven. So it's not that I have been approaching my patients and saying, hey, do you want to get your microbiome tested, or do you want to look at your enzymes, or etc. I'm now getting patients who are traveling from around the world. I had one from LA last week, there's the couple from Stockholm coming next week, and they're traveling in to get their microbiome tested, to look at their enzyme biomarkers. And so it's actually been very patient driven. And then also on top of that, it's doctors. So a lot of the doctors in my kind of area are now sending their patients to me. And so these patients are often patients who have a lot of maybe other medical issues. And a lot of these doctors are realizing that their mouth and their oral health is a very important part of it. And so they're sending these patients to me for microbiome testing, etc. And the idea is that, I sort out their mouth, I reduce their inflammation, make sure they have no infections, get rid of their bacteria, and send them back to the doctor. And it's a really nice way of communicating with the doctors as well.
And which kind of doctors are these ones sort of give up?
Usually like functional, we've got a lot of like holistic or functional doctors, or nutritionists, naturopaths. I'm getting a ton of nutritionists who are sending their patients. And again, it's often because these patients have a lot of problems and they usually have a lot of inflammation. So it's like a chronic inflammation. It could present as arthritis, as Alzheimer's, diabetes, heart disease. Any of those are basically inflammation of some part of your body. And so what the doctor or the nutritionist is understanding is that actually, if we can make sure there's no inflammation in the mouth, then that will reduce the inflammation elsewhere in the body. And so that's, it's worked out really well.
Oh, it's incredible. I really believe that the future of our dentist is really to connect the mouth, our mouth with the body. Because we cannot do a shielding, we cannot put an implant, and really don't think about like the impact that can have in our body. And do you feel that you have really difference in the people's saliva, like when you have implants, when you have like metallic restorations, prostheses, whatever? It's really different, or no?
Not for restorations like fillings, not really. But with crowns, like if it's like a full mouth rehabilitation, full mouth crowns, yes, their saliva is definitely different. And I have done microbiome testing before and after a patient has had like a full mouth rehabilitation. So I had one patient, she came to me, she wanted, to be super healthy and everything. And we do this microbiome test, and then I don't see her for like 6 months. She never really came back. She comes back. She went to Turkey, got like 30 crowns done. And like quite poorly done, like they weren't great. And she comes back to me. She's got gum disease everywhere. She's in pain. And I just was curious. So I did another microbiome test on her, and the bacteria was just crazy. It was all over the place. There was high levels of very bad bacteria. Her saliva was very, very different. And part of the reason is because the mouth is one of the only places in the body which is non-shedding. So that means that if we are not manually cleaning the teeth and getting rid of the biofilm and the bacteria, that it will just continue to grow and mature and get kind of worse. And then us dentists, we like to make life more complicated, because then we add crowns and veneers and dentures and braces and Invisalign and all of this, which adds another surface for that patient to clean. And if they can't clean that properly, then yes, the bacteria will change and their microbiome will change and they can have a lot of problems.
Oh, for sure. It's so interesting. And is there any difference? So this is a curious that I have. Is there any difference regarding to the surface of the implants, if it's a zirconium or if it's a titanium implant, or you don't know?
So I'm looking into it. I don't place implants myself. I leave it to the people like you to do. But from what I understand, the zirconium implants are better in terms of bacterial colonization. Just because of the texture, the surface roughness and the surface texture, that it's better. But just the screw itself is what I've heard. But with that being said, I mean, so many patients, I would say 90% of the patients I see have titanium implants and they seem to be completely fine. I think it's more a case of the way it's placed, who's placing it, how it is, you know, as opposed to maybe the surface texture.
Of course. No, you were talking about really that case of a patient that went to Turkey. Of course, it has, like, the gingiva was fully inflamed. Of course, if it was well placed, like if the implant was in balance with all the system, it would probably be okay. No?
Yeah, exactly. I think, like, for example, with this patient, again, if she had had that work done properly, or if she had had her microbiome stabilized before, and she had had her gum disease completely stable before she had all of this work done, it would have been a whole different situation. But it was the fact that, you know, she had these done, they weren't done well, she had gum disease, and she just made things 10 times worse because obviously she couldn't brush her teeth. So then when you add 30 more things in the mouth for that person to brush, and they can't even brush their own teeth, then how are they going to keep those, properly?
And do you have, like, for sure you have a lot of patients with other medical complications, but also you have healthy patients, no?
Yeah, sometimes I see healthy patients.
Sometimes?
Yeah. No, I see it, yeah. So again, a lot of patients who are finding me are ones who are actually super healthy. They are healthier than normal patients. You know what I mean? They're like one above because they are really into it. And again, it's even for them, just testing their saliva, it allows them to track their health. And I think nowadays everyone's obsessed with kind of wearables, like they're all wearing their Whoop.
I don't have mine.
Where's
no.
your Whoop?
No, because I have it was without battery.
Oh, shit.
Sorry. No, I bought mine because of you, huh?
Yeah, see, so everyone, though, you've got your Fitbits, your Apple Watches, your Whoops, everyone's tracking everything, and then even your blood tests. And so for those types of patients, even doing their saliva testing allows them to track their health and to see what they can change and to keep things going well.
And for sure you have a lot of approaches from colleagues that want to know what are you doing. They also want to do it. Do you see? One day, of course, you will have a lot of followers, like colleagues, and you need to teach this maybe one day. But do you think? Do you see possible, like, to complement your area in general practices in the future?
When you say general, you mean medical or dental?
In dental.
Oh, as in, do you think more people will be doing it?
Yes.
I think so. I think definitely periodontists and people who are very focused on the gums will definitely start to do it. And even, I was at Europerio like 6 months ago or something, and pretty much I would say like 60-70% of the lectures were on the microbiome, on bacteria, and there were even a lot of companies which were talking about oral microbiome testing. And I think it is the future. And I think for a really, really long time, us as an industry, dentists, we all thought that, all bacteria was bad. And so that's why we would just get rid of everything. And that's why we have all these mouthwashes and, you go for a clean and they just get rid of everything as quickly as possible. But actually now we've come to realize that it's not all bacteria that's bad. It's certain bacteria that we need to selectively remove. And how do you know which bacteria are bad? You have to test them. So I think that, we're always a couple of steps behind the medical kind of world, and with them, everything's becoming personalized. So, you know, you go to the doctor, it's all about personalized medicine, about prevention, and dentistry is going to go down that route too. And it's going to be, you know, it's not just going to be tell your patient to brush better, floss, and use a good toothbrush. It's going to be, you know, use this mouthwash, eat this food, take these supplements. It's going to be everything to be personalized to help that patient be better.
Because in the clinics that you work nowadays, do you have other specialists like the nutritionist, which doctors work with you daily in order to have like this complemented oral and food health?
So in the actual clinics I work at, we don't have like an on-site nutritionist or gastroenterologist. I have ones that I just work with myself. But what usually is happening is that the nutritionist or doctor is sending the patient to me from elsewhere. And so we then cooperate that way. And I say, look, this is the bacteria that I want to get down. This is what I would recommend, but you know, it's up to you what you do. And then we create a treatment plan together and we're collaborating.
Wow, so cool. I have here a sentence that you said that is, I want a world bacteria peace. That would be the dream. I love this sentence. It's everything. It's all about you, no?
No wonder I have like this weird reputation in the UK as like the saliva queen or the bacteria queen. I'm really making a good name for myself.
Which is good, huh? It's very nice.
It's definitely unique. I don't think there's anyone else out there with that name.
Yeah, you are opening the way. You are being super pioneer. It's incredible because I truly believe that the dentist of the present and of the future, it's a more conscious dentistry, you know, and we need to realize the impact of what we do in people's health, and what can we see, what can we touch, and what can we measure, and if we don't measure, we don't know it, we are not doing nothing. Now we can really create damage on people else. So I truly believe that this is the future.
Yeah, I think you're right. It's when I graduated, I remember, you know, the way that we were checking for inflammation was we would poke the gum and see how hard it would bleed, like how quickly it would bleed back. And if it bled very quickly, you'd be like, there's inflammation. I'm like, that's ridiculous. You want me to just sit there and poke people's gums and see how, you know, how much it bleeds? And to me, that's very like backwards. Like it's not quantitative. There's nothing that you can measure. And that's why the future is actually using what is there, the saliva, and to actually create numbers. Because firstly, we can communicate better with doctors and we can say, look, this patient has high levels of these inflammatory markers, this bacteria, and this is what I'm going to do to get rid of it. So doctors now understand what we're saying, but also patients, because we sit there and we tell our patients, you have gum disease, you've got pocketing of 4 millimeters, and you've got bleeding on probing, and no one knows what that means. And so they go home and they say, oh, okay, I have gum disease apparently, I need to floss better. But if you gave patients numbers and you said, okay, these are the targets that I want you to achieve, and I'm going to test every 6 months and see how it goes, then your patients are going to be a lot more motivated and compliant as well.
Of course. And you do that testing probably when you do the prophylaxis, no?
Yeah, so right before we do any prophylaxis, so we do guided biofilm therapy.
Yes.
Before the guided biofilm therapy, we do microbiome testing.
And you were also like one of the pioneers of the guided biofilm therapy, no?
I wouldn't call it that, but I'm a big fan of guided biofilm therapy. I think it really just aligns with my like kind of my mentality, I guess. It's minimal. It's effective, and for me it's all about making the invisible visible. So if you have inflammation, I want to see the numbers for it. If you have biofilm, I want to see the biofilm. And so with guided biofilm therapy, you literally put a plaque disclosing tablet and you can see what the biofilm looks like, and then you can remove it. And it's also got really good benefits on the microbiome as well.
For those who are listening or seeing us and don't know what is guided biofilm therapy, is like the new, or not the new, the EMS technique for oral hygiene that we also use here at the clinic, and Victoria also. And it's consisting in a very specific protocol, less invasive, more comfortable, more effective, and with the best experience for the patients.
Yeah, definitely. I mean, my patients absolutely love it, and I think that's how we met as well, was through EMS. So
that's why we're here today.
Exactly. So we have a lot to thank for EMS.
And Victoria, tell me how the artificial intelligence entered in this process of your tests.
So the more testing I was doing, the more numbers and the more data I had for patients. And it got to a point where I didn't have enough time to analyze everything. And there's just so much data. You know, if you're looking for a patient, you're looking at 14 different bacteria over 3 years of testing every 6 months. That's a lot to kind of understand and to digest. And so we started to implement artificial intelligence to help us to at least analyze some of these, trends or these scores. So I use it to help me make the graphs, which will show, the levels of bacteria and how they're going. But then also with my x-rays as well. So what I've started to do is, there's a company which uses AI to actually highlight all of the kind of pathologies in your x-ray, so your bone levels, your decay, even your, your inflammation, anything you want, and it highlights it in different colors, and it also measures it. So you can actually measure how much decay there is, how close it is to the pulp, how much it's traveled or gone since 6 months ago. And so it's really good for me as the dentist to be able to say to my patient, hey, we're 80% into the tooth. We're only 20% away from the nerve. So you have a very high risk of devitalization or having problems afterwards. But also for once the patient actually understands what you're saying, because usually, I don't know, I feel really stupid. I've got an x-ray in front of me and I'm like, do you see that little gray? And they're like, no. And I'm like, do you see it's like a little bit different to the color next to it? And they're like, what is she talking about? So this way he highlights it in different colors. You've got numbers. And again, I think you could probably see from everything I'm saying, I'm a numbers girl. I like numbers. I like data. I like, something I can track. I don't like anything wishy-washy.
I want to ask you, how do you feel? How is your struggle? Because you are developing a new area, like a new way of relating with the patients, and it's always difficult to start something.
Yeah.
Because we know that we have other dentists, other colleagues, what she's doing. Tell me, how is your battle to stand for your technique and for your new approach?
I mean, it's a really interesting question, because I think, you get a lot of people, you get your haters. I have a lot of people who don't maybe believe what I'm doing. Usually it's the older dentists. And that's because they think that I am trying to kind of disrespect what they've been doing for the past 50, 60 years, So if you go to a dentist who's in his 70s and I'm like, hey, I want to do microbiome testing, I want to use artificial intelligence. And they're like, well, it worked for us for the past 50 years, so why do you need to change it? And my answer to that is always, well, we can always improve. We can always get better than what we have. So I do have a camp of people who maybe are not the biggest fans of me, but for every one person who is not that supportive, I probably have about 5 who are supportive. And I think that I think as long as you yourself are really passionate and think that this is the way, then no one's going to stop you. And I get, once I was in a lecture and I was lecturing and someone stood up and put their hand up and they were like, sorry, who are you to be telling me what to do? And they were like, and because I look quite young and all of this, and they were like, you look too young to be telling me what to do. And I was like, okay, thank you. That's very kind of you to say in the middle of my lecture. But also, I am, without sounding arrogant, I am the future of dentistry. If you say I'm too young, it's because I'm the one who's looking, I can see what I want to do and I can see where the future is going. And, yeah, if people don't want to do it, they don't have to, and they can stick with their old school dentistry, and that's great. But as I said, it's very patient driven. And so patients are the ones who are actually supporting and try and pushing me to do more and more.
It's beautiful, inspiring, your story. And thank you for sharing with us today. I really appreciate it. And I think it's going to be like incredible for people to know you better. I hope you receive more patients in London.
Yeah, please.
Now, everyone needs to follow and should follow Victoria on Instagram. It's Victoria Sampson. And I wish you all the best. Okay. And hope to...
Thank you very much for having me. And yeah, I hope to see you soon too.
It was really incredible. Thank you for everything. And good luck.